Hello everyone, good afternoon. This is Miss Henderson and today I'm coming to you with a simple video on the function of a home health aide or a certified nursing assistant. So I hope you find this video informative, and if you do, please give it a thumbs up and subscribe to my YouTube channel so you will not miss any more informative videos. So this video talks all about the function of a home health aide and what are the responsibilities of a home health aide. So let's look at the student learning outcomes for this video. Discuss the purpose of a long-term care facility. Describe the function of a home health aide. Discuss the purpose of hospice care. List 4 chronic illnesses. Define health maintenance organization. Define dementia. Discuss the structure of the healthcare team. So the first slide here, we have the purpose of a long-term care facility. So as we know, a long-term care facility it's a nursing home. It's where residents live there and they receive care. So the main purpose of a long-term care facility is to provide care for the residents who require assistance with activities of daily living. So what are activities of daily living? Here are some examples of activity of daily living or ADLs. Grooming, transferring a patient from a bed to a wheelchair or a wheelchair to a bed. Toileting a resident or also feeding a resident. These are some examples of activity of daily living. And as a home health aide, you play a pivotal role. You help residents with their activities of daily living. The next slide is the responsibilities of a home health aide. So HHA stands for Home Health Aide, provides care for clients in their home or in an assisted living facility. Function of a HHA includes monitoring a client's vital sign, remind the client to take their medications, light housekeeping, transferring a resident, bathing a resident, and grooming a resident. So these are some functions and some responsibilities of a home health aide. They are also much more, but these are some basic functions that you're expected to do, and that's within the scope of practice. Hospice care. So as we know, hospice care is designed for clients that have terminal illnesses, such as patients with advanced HIV, patients with advanced cancer. These patients, a lot of time, they're placed on hospice care. So the main goal on that hospice focuses on providing comfort and also pain management. A lot of times these clients are receiving pain medications around the clock, and as a home health aide or a CNA, your job is to remind them to take their medications, providing comfort. Maybe you turning and positioning them from side to side. Maybe you're providing a back massage for them. That's providing comfort for them. Or maybe you just sit there and listen to them and let them reminisce about the good old time. So that's promoting comfort. So dementia is defined as a loss of mental ability to reason and communicate information in a logical manner. So symptoms of dementia include, but not limited. A lot of times patients with dementia have limited social skills, impaired reasoning. Their ability to reason things in a logical manner is impaired. A lot of times they become very irritable and very combative. A lot of times they also have anxiety and they're also at risk for falling. And sometimes they wander away. So working as a home health aide or a certified nursing assistant with this type of population, the main goal is to promote safety, providing a safe environment for them. I have a worksheet here with some simple questions actually on how to answer questions on home health aides. And this worksheet, I hope you find it informative and it helps to deepen your understanding on home health aides. So I have a question here. The first question talks about what care should be given to a patient who is approaching death. So we know a patient that is terminally ill and it's approaching death, we know that you provide comfort for them. So B would be the correct answer for that question. I have another question here. A patient with dementia may repeat the same words over and over. Yes, they do that. A lot of times patients with dementia, they repeat the same word a million times. So what should you do as a home health aide or a CNA? Involve the patient in activities. A lot of times you get them involved in things that they like to do. It's providing a means of distraction. What is true about routine weighing a resident to determine enough nutrition, to determine fat, to determine calories? So the correct answer is A. Question 4, which of the following will prevent back strain? Raising the bed to working height. So back strain, raising your bed to working level, it's critical as a healthcare provider because you're trying to prevent back strain, back injuries. When cleaning a resident dentures, the sink should be lined with a barrier to prevent breakage of the denture, because sometimes these dentures are very expensive. So by provide a barrier in the sink, and if the denture falls, it actually provides a cushion for it so it doesn't break. Which observation should be reported to the charge nurse? Frequent liquid stools. So these are some questions on home health aid, how to answer home health aid questions. I hope you like this video, and if you do, please subscribe to my channel. And leave your comments and your thoughts below this video, and let me know what type of videos you like me to provide for you that can help you answer anything in the medical field. Thank you so much for your time and your patience. Bye for now.